Welcome, PCB students and parents. If you're navigating the crazy maze of medical career options right now, you've probably stumbled across BNYS. But what's actually behind that acronym? Is it a golden ticket or a path to mismatched expectations? Well, let's jump right into this explainer and strip away the myths to look at the cold, hard facts.
Here's our roadmap to uncover the absolute truth about this degree. We're going to cover 1. What the BNYS degree actually is. 2. The academic and clinical journey. 3. Vast career and sector options. 4. The honest salary reality. 5. Rising demand versus field challenges. And finally, 6. Is BNYS right for you?
All right, kicking things off with Section 1, what is the BNYS degree? Unpacking the acronym.
BNYS stands for Bachelor of Naturopathy and Yogic Sciences. Now, it is absolutely crucial to understand right out of the gate that this is a professional degree, fully recognized in India under the Ministry of Ayush. We're talking about a comprehensive medical and wellness program that's entirely focused on natural healing methods, yoga therapy, and preventative healthcare. The absolute key phrase to remember here is drugless treatment approaches. You know, this isn't just some casual weekend certification you pick up online. It's a profound commitment to a very specific philosophy of healthcare.
In the curriculum itself, it's a fascinating hybrid. On one side of the coin, you are mastering strict, traditional modern medical foundations. You're going deep into human anatomy, physiology, pathology, and microbiology. I mean, you really have to know how the body works on a cellular level. But then, on the flip side, you're simultaneously learning specialized natural therapies, things like hydrotherapy, mud therapy, fasting, dietetics, and acupuncture. So it really is this demanding, intense fusion of modern diagnostics and traditional natural interventions.
So, how do you actually get there? Let's move to Section 2, the academic and clinical journey, the rigorous path.
5.5. Yep, 5.5 years. That is the massive chunk of time you're going to commit to this course. I really want to emphasize this because, honestly, there are no shortcuts here whatsoever. You are dedicating over half a decade of your life to mastering this dual discipline.
And you definitely don't just jump straight into yoga poses on day one. The journey builds systematically year by year. Year 1 hits you with heavy scientific theory, medical foundations like biochemistry and anatomy. Then, Year 2 advances into clinical basics like pathology and community medicine. By Year 3, you're shifting into therapeutics, really studying nutrition, dietetics, and hydrotherapy. Year 4 pushes you into advanced clinical subjects, including obstetrics, gynecology basics, and physical medicine. And finally, the whole shebang culminates in Year 5 with a mandatory 1-year internship. This is where you get real clinical exposure, handling actual OPD and IPD patients. It's a massive, highly structured academic mountain to climb, for sure.
Okay, so what do you actually do after graduating? That brings us to Section 3, vast career and sector options beyond the clinic.
A lot of people assume medical degrees only lead straight to a hospital ward, but BNYS actually gives you an incredibly versatile toolkit. Yes, of course, you can go into standard clinical practice as a naturopathy physician or work in Ayush and Nature Cure hospitals. But the canvas is surprisingly broad. You can pivot into the corporate sector as a stress management consultant, which, let's be honest, is a huge market right now. You can work in luxury wellness resorts. Or you can take the entrepreneurship route. Open your own clinic, run a specialized yoga studio, or even build a global client base through online health coaching.
But let's ground this with some hard truths in Section 4, the honest salary reality, expectations versus reality.
We need to have a serious reality check about your earning potential, because this is exactly where a lot of students get a massive shock. You might struggle if you're expecting a giant paycheck on day one. For a lot of entry-level roles in India, the starting salary is honestly quite modest, usually around 2.5 to 5 lakhs per annum. That starting number is going to depend heavily on your individual skills, the clinical exposure your specific college gave you, and where you're located. So if you're comparing this to the immediate financial security of some other fields, you really need to recalibrate those expectations.
If you want to scale your income and earn significantly more, you basically have to become an entrepreneur. Experienced professionals definitely make good money, but they do it by building a rock-solid personal brand. They leverage digital and social media to educate the public, they actively hustle for those lucrative corporate clients, open their own independent practices, and attract premium wellness clients. Your medical knowledge absolutely has to be matched by your communication and business skills.
Which brings us perfectly to Section 5, rising demand versus field challenges, the future landscape.
Despite those initial salary hurdles we just talked about, the outlook over the next 5 to 10 years is incredibly strong, and here's why. We are seeing a massive global explosion in chronic, modern lifestyle diseases. We're talking diabetes, hypertension, back pain, severe anxiety, obesity, and sleep disorders. Traditional medicine is fantastic for acute care, but patients are increasingly looking for supportive, lifestyle-based wellness approaches to manage these chronic, day-to-day conditions alongside their regular treatments. Schools, hospitals, fitness centers, international retreats, they're all waking up to this need. This huge shift in global health is exactly what's creating long-term opportunities for trained BNYS professionals.
However, it's not all smooth sailing. The biggest reality check you'll face in the real world is that public awareness about BNYS is still way lower than, say, an MBBS or a BAMS degree. You are going to have to constantly educate people on what your degree actually is and the hard science behind your treatments. Plus, fast government placements are not guaranteed, and your job opportunities will depend heavily on the state you live in and the professional network you actively build yourself.
There's a really powerful piece of practical advice floating around the online community right now that says, choose BNYS only if you genuinely like the field, not only as a backup medical option. This is honestly the most crucial takeaway today. If you're only here because you missed out on an MBBS seat, those 5.5 years of grueling study and the entrepreneurial hustle required afterward will completely burn you out. You have to genuinely love the philosophy of preventative care.
That leads us right into our final section, Section 6. Is BNYS right for you? The final verdict.
BNYS is absolutely 100% not a shortcut doctor course. It is a fantastic fit if you genuinely love yoga, nutrition, and natural healing. It's for people who enjoy long-term patient communication, who have that spark for wellness entrepreneurship, and who are totally comfortable putting themselves out there to build a reputation. But on the flip side, it might be a terrible fit if your primary goal is fast, easy income right out of college, if you crave the immediate public recognition of traditional allopathic medicine, or if you simply prefer the environment of traditional prescription-based hospital medicine.
So, I'll leave you with this final thought. Are you ready to build your own reputation from the ground up in the exciting, rapidly growing field of preventative healthcare, or are you just looking for a medical shortcut? Take a moment, step back, and reflect deeply on your true motivations before committing half a decade of your future to this